Are you ready to successfully transition from breastfeeding your baby? In this video, I'm going to show you how to safely wean from breastfeeding and prevent mastitis. 1. How long should I try to breastfeed my baby? The World Health Organization recommends exclusive breastfeeding for the first 6 months, and then complementary feeding along with continued breastfeeding for up to 2 years or longer. If you are having difficulty weaning your baby from breastfeeding after a year, it is important to talk with your healthcare provider about other options that can help make the process easier. 2. What are the signs of a successful breastfeeding transition? When breastfeeding is successfully weaned, it is normal to experience some physical and emotional changes. It's important to recognize the signs of a successful transition so that you can adjust as needed. Physically, you may notice a decrease in breast tenderness and engorgement over time. You may also start producing less milk, and your breasts will gradually become softer and smaller in size. As for emotionally, you may feel relieved that your breastfeeding journey has come to an end or experience sadness at the loss of bonding with your baby through breastfeeding. Regardless of the emotions experienced, it's common to grieve during this process in one way or another. 3. When is it time to stop breastfeeding? It is ultimately up to the individual mother and baby to decide when it is time to wean. Generally, the recommended age range for exclusive breastfeeding is between 6 months and 2 years. However, mothers should be aware that the American Academy of Pediatrics encourages continuing breastfeeding until at least 1 year. Many mothers continue past this point if they are able and willing. Whenever possible, weaning should be gradual in order to reduce discomfort for both mother and baby. When deciding when to stop breastfeeding, it is important to consider potential risks associated with extended breastfeeding, such as mastitis or oversupply of milk. Mastitis occurs when bacteria enter a breast duct, resulting in an infection that can lead to swelling, tenderness, redness, pain, and fever. Fortunately, mastitis can be easily treated with antibiotics and lactation support. Additionally, an oversupply of milk can occur if the baby is not nursing as frequently as the mother's body is producing milk. This can cause pain or discomfort in addition to other symptoms such as engorgement or plugged ducts. If a mother experiences any of these symptoms, she should consult with her healthcare provider before continuing breastfeeding to identify the best course of action. 4. Is mastitis common after weaning from breastfeeding? Mastitis is fairly common after weaning from breastfeeding. The change in hormone and milk production levels, combined with the physical stress of uncomfortable nursing sessions, can weaken a mother's immune system and make her more susceptible to infection. Breastfeeding mothers should increase self-care measures, such as consuming adequate fluids and rest, maintaining good hygiene practices, and watching for signs of infection during the weaning period. If symptoms of mastitis develop, it is important to contact a healthcare provider for diagnosis and treatment options. 5. What steps can I take to prevent mastitis during weaning? When weaning, it can be helpful to gradually reduce the frequency of breastfeeding sessions and replace them with other activities. This will ease your body into the transition while reducing your risk of mastitis. Additionally, make sure to give yourself plenty of rest and drink lots of fluids. If you experience any symptoms of mastitis, such as fever or redness on the breast, contact a healthcare professional for treatment right away. To reduce discomfort during weaning, try applying cool compresses or taking ibuprofen as needed. Finally, don't forget to practice self-care. Take time out for yourself to relax and unwind when you can so that your body can naturally adjust to the change in schedule. 6. Are there any tips or tricks for successful weaning from breastfeeding? Yes, there are some tips and tricks for successful weaning from breastfeeding. Firstly, it is important to take your time and go at a pace that works best for you and your baby. Gradually changing the length of time spent nursing or gradually reducing the number of feedings per day can be effective strategies. It can also help to think ahead about alternative activities that can be done instead of nursing when times become difficult. Having activities such as reading books together, going outdoors to play, or listening to music can help keep both mother and baby calm during the weaning process. 7. Are there any health benefits associated with extended breastfeeding versus early weaning? Yes, there are health benefits associated with extended breastfeeding. These include improved cognitive development and better nutrition for the baby, as breast milk contains more nutrients than formula. Extended breastfeeding can also reduce the risk of certain illnesses and diseases in both mother and child, such as obesity, diabetes, asthma, allergies, ear infections, and certain cancers. Additionally, it can help to create a strong bond between mother and child. However, it is important to be aware that prolonged breastfeeding may increase the risk of mastitis due to increased chances of cracked nipples or blocked ducts, which can cause infection. Talk to your doctor if you have any questions about extended breastfeeding. We hope that this video has provided you with some useful information about how to safely wean from breastfeeding and what symptoms of mastitis you should look out for. If your baby is having difficulty transitioning, be sure to talk to a healthcare professional who can provide more personalized tips on how best to proceed. Don't forget to leave us a comment below and let us know if there are any other topics related to parenting or childcare that you would like us to cover in our next video. And don't forget to subscribe so that you can stay up to date with all the latest videos from our channel.